is in that pronated position.
Yeah, they have no idea.
Yeah, they have no idea. We saw a kid this weekend in the clinic, pretty high-level athlete, and he was having all kinds of knee and hip stuff. And you looked at the poor kid's feet, and like his tib posterior was already completely, like he's just completely collapsed.
He's just in. How old is he?
He's like 14. But yeah, like his jump test, his knees are in, and he was having a lot of anterior hip,
He's
knee,
just
everything in. Yeah.
I was we had a student in.
Yeah, like you gotta fix. Yeah,
we gotta
fix that.
Help.
Yeah.
I mean, I guess you could start here and try to.
Well, your shock absorbers are here, right? And if you jump, this is your shock absorbers are like here down. Wouldn't you agree? Like this.
Oh, yeah.
This is
like
the knee.
quads,
The
like
knee, Achilles, foot, plantar fascia is your shock absorber.
We had a student, and this is a wild story. He actually got appendicitis when he was on his clinical here.
Yeah.
Wild.
Oh, fine.
But so he recovered. He couldn't you can't lift too. Like he just had some lifting restrictions after.
Yeah.
But he presented. We put it on the TV. He presented on post tib like tendon dysfunction, and I was gonna look it up anyway, but I'm like, hey, this is your project. I want to learn from him anyway. So it's funny. It's all these kids now that use AI to get the key points from the research articles. So you could just go ChatGPT and say, can you give me, can you tell me about this part of the article? And it reads the article and tells you what it is. Yeah. So it's great if you want to read research faster. So I just think kids now know how to use that. But he summarized a lot of stuff really well where once you get past, I'm sure you know this, but once you get past that stage 2, there's stage 2A and B, I think.
Yeah, I don't know what the stages are.
I believe it's stage 2.
Mine is really fucked up, a little bit.
It starts getting really messed up.
Yeah, your boards are like my boards were like their foot's messed up.
Yeah, your foot's messed up, man. There's a point where
complete disaster.
There's
yeah.
There's no conservative care. You can't there's no rehab of it. Your foot just becomes stiff, and then eventually I think stage 4 it just becomes malformed, and you're just in this rigid, stiff flat foot. And there's your post tib is torn. What you really do.
It's like the underwear waistband that's now not coming back.
Not coming back. So I think something I've definitely taken more seriously now is if I see someone and their toes are a little bit clawed, I'm like, we can actually address let's address this now before you turn into the 80-year-old that has these crazy hammer toes.
And then they fall.
Yeah, then you fall down. Now you get your balance.
Not because the balance is your toes, right?
Especially learning that from. I've noticed it, but after I dropped it, is that 3 weeks ago I dropped it or a month ago? After I dropped in, I'm like, again, let me.
Courtney Conley has really good stuff. Do you know Courtney?
Is she Gait Happens?
Yeah.
Is that, okay. I've heard some stuff from her too.
She has a book. She's almost done her book. I'll be on a call with her tomorrow. I'll ask her how her book's coming.
Oh, cool.
But she did Peter Attia's podcast maybe 6 months ago, and they had all these little videos of these little tests, you're barefoot and kind of you're here, and the little strain gauge, I have one at the store.
Is it you can put on the bottom of your toes?
Yeah, you would stab it, and it's like a card with a strain gauge. Tom Michaud is the guy who I should give you a copy of his book. I have one. Do you know Tom Michaud?
I'm not.
He's up in Massachusetts. M.A. What the heck is the name of his book? He's the most brilliant person in all of this space. I'll send you a link to his book, but he's truly a mad scientist.
Is it Thomas Shaud?
Tom Michaud, Machaud.
Okay.
Speaks at a level that,
cool.
It's running. What the heck is the name of his book? I wrote the foreword of it. Yeah, but it was but it's running something running injuries. Michaud book running. I don't know why I can't remember the name of the book. Too many books. Yeah, you'll love this book because you'll have to read it 3 times to even begin to understand all the diagrams. And
that's gonna be
injury-free running. Right here. This book is worth your while.
Oh, cool.
He is the guy.
And
he treats, in that whole New England area, he's the go-to guy for all of the New Balance people up there, all the professional runners.
All the sponsored ones?
Yeah, because there's a big group of professional runners in Boston, and he's the guy, because they trust him.
Yeah, I feel there's
Here, I'll forge. What is your What is your I don't have your text. Let me just text
That
this.
would be. You ready for it?
Yeah, hold on a second. Then we'll have your text here. Hold on, let me grab this. This is my housemate. Sue.
Hi. Hey, are you at the store?
No.
Okay. All right. Bye.
What you need? Oh,
No, Alan wants to come down sometime when you're at the store so he can get pickleball shoes.
oh, okay.
Yeah, so
Is
you
his
can have
foot
them.
better?
Oh my God, it's 100%
He's
better.
he's 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 cured. It's funny.
Cured, and you know what?
Tell me he owes me a bottle of wine.
You are Jesus Christ.
No, I'm
So there's
joking.
nothing like shoes.
Okay,
No,
I'll connect with him. I'll be there this weekend, and we'll get him
okay.
hooked up. Okay,
All right.
bye.
Okay, bye. See you.
Funny you say that. What's your text?
Oh, 315 271 8675.
So this is funny. This guy, he's one of my neighbors, and he's an author. And he was running this big workshop for authors at Shepherd. Like he was the lead guy. This big thing, a whole weekend thing, and it was going to be Friday, Saturday, Sunday, Thursday. He calls me. I can't walk. So he comes over, and I give him the barefoot science insoles, and just like a sleeve, and like here, just do this. And the next day he texts me. He's like, "Oh my gosh," he like wanted crutches. I'm like, "No, just don't go. Just look, it's you have plantar fasciitis,
Yeah, you're gonna be okay.
You're gonna be okay. You gotta walk through it." And now he wants to come to the store and buy shoes.
That's funny. Did it work that day?
Yeah. The next day, I mean, he's still, I'm sure, but his pain was gone.
Okay, good.
Yeah, just that. I mean, because that, like, some people, your feet are so sensitive, right? Like, there's not like a big injury, but man, that hurts.
Yeah, it's not fun.
It's not fun. And
What do you always start them in level 1 for the barefoot science?
Yeah, usually, even if they don't really feel level 1 much, just to get, because usually they're asymmetric, so just kind of just get them used to something, and then like in 2 weeks go to 2, and
you typically do 2 weeks. Isn't that what they recommend?
yeah,
Like 2
yeah.
weeks,
But again,
switch
like I
it?
think you have to nuance it. Like if you're still feeling like people that have
That's the last one.
really severe dysfunction, right? Like it's going to take more than 2 weeks to really like someone whose tib posterior is really collapsed, intrinsic muscles are shot.
Yeah.
I mean, it's not like your PT. Like in 2 weeks, they're not going to like wake all that stuff up. So some people might be in level 1 or level 2, as long as their pain is a little better. They don't have to.
Yeah,
they don't have to. Yeah, they don't have to like. There's not like some goal like you have to. And I don't think many people even get to those higher levels unless you have a really high arch foot, right? Like because that high level is not going to feel comfortable in more of a flat foot, a naturally flat foot. That's gonna feel off. So.
Yeah. Do you because I've always thought that like if someone has a higher arch foot, well they're probably too stiff, and we want to get the arches active, so they can use the arches as a shock absorber because their foot's already so stiff. I guess I guess anytime I've had someone who has a high arch foot, they seem to respond to that.
To what specifically? Is it just
Getting the arch more active, like learning to turn on and like.
Yeah, I think like jump rope, plyometrics, being in a more minimal shoe to, I think looking at the arch of the foot doesn't tell you really anything about the function, the strength of the foot. The article we were talking about, the foot, McEwen's foot core. There's the bony structure, then there's the neurologic input to the foot, and then there's the muscular function. So like what's going on? Like I've seen plenty of people with high arch feet who are really good shock absorbing feet, and so.
Yeah, it was always a funny photo. It was a photo of I forgot what. There's some blog I saw where it was like, I think you've probably seen this too, but it's a foot that just has like a six-pack on it, like.
Yeah.
I'm like, that's the foot you want. Maybe not.
That's what you want.
Like that, but you want the foot that's active, that's strong, it's doing things.
Yeah, and that's why we did the, if your camera's on here, the foot core, which is the, the plank of the foot, right? You just kind of come up and you hold 30 seconds with your heel up, right?
Yeah.
And then that's like really working those muscles and things really start to light up. And you might start with just 10 seconds, but, progress to, if someone can kind of hold 60 seconds like this, that's pretty good.
That's not bad.
And most people need to hold on.
Barely off the ground.
Yeah, just barely off the ground, right? Just barely off. It's, it's like a plank, you know, and all
Plank
those
for the
muscles.
foot.
It's the foot plank.
No, it's a good. Yeah, no, it's a good.
Yeah, like anyone try it, you're like,
Did,
oh man, that's
so
hard.
The standards a minute. What's the?
Well, I think if you can do it, I mean, I don't think I can even do it. Like my foot starts to really, I got pretty strong feet, but just balance here. But yeah, just holding here, you know, and count even for 20 to 30 seconds with that heel up, and things start to really, you know, flex your knee a little bit, don't get stiff, but yeah, just hold it, right? Just isometric strength. Yeah, you're like, and you could be on your, you know,
You could do
doing
whatever you
anything.
want. I've sometimes give people the they'll do that, and then I didn't even think about that it was I just kind of had an idea that it was going to be good, but
Yeah, try it. Just do it.
I'd have them do it, and I'd have them pass the kettlebell from side to side.
Yeah. No,
Just
that's
make it-
even more. Yeah,
make it
that's
even,
like
like,
next.
worse.
Yeah, you have good strong foot.
So
That's like next
I can
level.
hold it, but yeah, you give me try to pass it. I'm like, oh, it's gonna be rough.
Yeah.
That's not gonna be fun.
Yeah, your patients, you know, probably not many of them can just hold there in that
start to lose
position.
it.
They start to lose it.
That's a good. I gotta start. I'm gonna start including this more on tests of.
Yeah, this could be like one of your tests. You know, functional strength, balance.
Yeah,
And if they have a big toe that's bent in, you know, they're going to have a really hard time doing that because they're their big toe.
If they got a bunion, it's not
If they have a
gonna-
bunion, it's not going to work.
That is not gonna help.
Not
What
gonna work.
I've been doing. I've actually taken one of Conley's courses. Learned a lot from it. That was it was worth it. I know she talked a lot about like I don't think she has bunions herself, but she talked about like
Yeah, she was a dancer.
the anterior tib tendon and the proneus, like the proneus rupture.
Proneus longus and brevis go around the lateral side.
But they were essentially like with the bunion, it's bunion versus hallux valgus. Like the hallux valgus is really the issue. Like that first met is rotating, and that's gonna cause like not the bunion, like the bone growth, but it causes the foot to like the big toe to twist. So a lot of people with the hallux valgus, I've been doing a lot of just like the shin raises and just like essentially work on stabilizing the first ray.
Okay.
And also do all the big toe stuff. So I'm curious what you think about that. But I've seen some good outcomes with getting everything that attaches to that first ray, and also just improving balance and foot control, obviously.
Yeah, we've tried it at the store, even explained, because the people think, not all, but some folks say, oh, the sesamoids are just wasted bones, right? And they're, for people watching, they're these two little floaty bones that sit right under your first metatarsal head. But the flexor hallux, meaning this is the hallux, this is the big toe, the longus and the brevis course through those two sesamoids, almost like the way like two piano strings would sit in a little groove. And that allows you to stab your big toe, not curl your big toe, but to stab it, right, to stabilize you. And what happens is when they get off the track, right, so here you've got these nice long tendons that allow your toe to go this way to stabilize you, but now they're off the track. And then they keep pulling, right, all day because they're off the track. And then once they're off the track, the deformity will just continue until you somehow can get it back on the track, and that's where the toe spacers help. You know, toe extensor stretch, like you can, in this position, take your big toe and kind of like bring it a little bit, we would call it medial, and then stabbed it, yes.
Oh,
and,
I see,
and try to get the get the strings, get the pulleys.
Get them back.
Yeah. And that's why, like my foot, mine are off the track permanently, so that it just will never.
Sesamoids are just off.
Yeah, just my foot looked like that 20-some years ago. So it's just, it's better. But again, if you're out there listening and you're not perfect, it's okay. You can still have a functional life.
Yeah.
I don't have any dorsiflexion of my toe. It's this joint is pretty much frozen. It was already like arthritic infused and bunions. But now it just is arthritic infused, but not as bunions.
So you fixed the part of the bunion.
Yeah. So
that's good.
you compensate and
So I feel like I have a hallux, not a hallux, but I feel like I have a Taylor's bunion, which actually this used to be
here,
super red.
Yeah.
So what
No,
do you
so you're good. So you can get your toe dorsiflexed, right? So that's
Yeah.
good. You can bring the arch together, so that's good. Yeah, and just see how you are. And this is what I see with a lot of people too, because you need, ideally, you've got like, what would you say, 60 degrees of dorsiflexion there, so that's good. That allows you to create a stable arch. But when you walk and run, your ankle is in dorsiflexion, you got toe off. See how you're a little tighter there?
I'm gonna fall off. There we go.
Yeah, so, when your ankle is dorsiflexed, toeing off,
Yeah,
so
does
you're
not wanna
still,
move.
yeah, so
Not
you
that
still,
bad.
but yeah, you have some, but
Oh, just
but
my
you're not,
medial.
yeah, this is your plantar fascia that's tight,
Okay.
but you can get in there and, work
it out.
that, dig it, you've done a lot of running, I've never met a runner who doesn't have a lot of tightness in their plantar. It doesn't mean
Yeah.
you can't run or anything, but if you had plantar fasciitis now, we'd get you to start,
Start
get a
digging in
fascia
there.
tool, one of those, one of those ones that look like the brass knuckle, and get in there and really
Yeah.
just
Get a scrape tool. Just work it
scrape
out.
tool, all the toys you have here, like over there, all the little toys
Oh yeah.
to roll on your foot.
Yeah. So I've thought about. And actually, I don't know why, but my interossei, like I've done a couple really like this one. It's always my pinky toe on both. Like it is. It's gotten better, but it was like exceptionally tender. And I'm like, it is. Like between the metatarsals, this guy
Yeah.
here, it was exceptionally tender, and I'm wondering if because of this how just the little bit of the
Yeah.
kind of adduction here, if that's causing the muscle to, or
Yeah,
one's
and
causing
what
the other.
what I think we see, and you studied it in your anatomy, all the nerves, the interosseous nerves, when your foot's compressed, like a lot of people get all these they call them neuromas, which basically means their foot hurts. But we want to be able to give that nerve some space. So for you being in the zero shoes, even correct toe, and even a little bit of manual therapy, you want to kind of give that, if the nerve is irritated and compressed, give it some space. You probably see that with a lot of people, second, third toe, because they're compressed.
Is it Morton's neuroma? Is that the second or third?
Yeah, it's in that area, but it's a descriptive term. People have pain, and some of it's just due to fat pad migration because
that's
their
right. Yeah,
toes
yeah.
are in extension. They're up here, which migrates the fat pad, versus when you bring your toe, when you put tension here, metatarsal pad, see how your toes come down?
Yeah.
Just by doing that.
Is
That
this
will,
supposed to happen?
yeah,
good.
straight. Yeah, this is
Good.
what you want. Like all the shoes with toe spring, meaning a lot of
Yeah, the
shoes
curve, right?
curve up, and then your toes look like this. When you're in your
Oh, when they're in the
40s.
shoe. Oh,
Yeah, but
I
then they
see.
stay like that, right? They're your first raise
That's-
or in
So
extension.
your shoe, so they don't stay like they won't just like a curve up. They'll tend to get.
Yeah, they'll
flexed.
tend. Then you'll
I
get
see.
this. So you've got to get
You
those
gotta stay-
toes
yeah.
out. Right?
I've noticed since I came to you like 3 weeks ago, I've noticed.
Yeah, like these
I've-
shoes will prevent that, right? Because there's no toe spring. Like a lot of shoes bend your toes up,
Yeah.
which
Okay.
which is not
I
good.
have noticed. I've noticed since.
Yeah.
I
Yeah,
don't
like
know why.
these, right? They're flat, right? They're not.
Yeah.
They're
There's
not
no like.
toe
There's
spring.
one shoe at the Charm City Run store. It was like I don't know what this thing was called, Mark, but it was like the curve was insane. It was like you didn't have to work at all to move. Like the heel
Yeah.
curve, the heel rocker was
Yeah.
massive. The forefoot rocker was big. It was just this like.
Yeah, and I think the difference, and if you're a customer buying a shoe, so you could have a shoe that the last is flat, but it has a little bit of a rocker, right? So that's keeping your toe flat, but the shoe rockers. But then there's shoes that the last is actually curved.
Oh, I
So
see.
just so most shoes that have a lot of stack are going to have a bit of a rocker because you can't imagine that you have a 30 millimeter stack height that went like that. That wouldn't be very,
Yeah.
no, because you do, and if you have a very stiff first toe from arthritis and you want to run, sometimes having that rocker actually is helpful because your big
Yeah.
toe, like for me having a little bit of a rocker, because my big toe will not bend, and if I really put too much pressure on this in like a 5-finger, this, pounding that joint versus sometimes like an ultra where I can just kind of
Yeah.
just
You get
rocker.
the rocker helps you move forward. So what's
Yeah,
the
but
difference
the-
again? You said the last versus.
Yeah,
what?
so flat last, so just make sure the last, which is the base of the shoe, isn't curving your toe up.
Oh, okay.
Yeah, so some shoes, the last is flat and the midsole curves.
Oh, I see. So essentially, in your case, that you want the outsole to curve, but the last to be flat.
Last to always be,
Okay, I
yeah,
see what
so
you're saying.
your foot should be sitting flat. So the last of the shoe, like that one obviously is a
Yeah,
flat
it's a flat
last.
What shoes typically have a curved last?
So a lot of the Nike shoes have a curved last.
Of course they do.
Yeah, nothing
they do.
against Nike. And sometimes just through time they end up kind of curving up, right? Like you see the shoes just.
Oh, as the shoe wears out.
Yeah, as the shoe, as they start to wear the shoe, right? Because they put.
Why never play shoes every once in a while?
Yeah, so people put a lot of pressure on the forefoot. So what happens is they'll kind of divot the forefoot down in the midsole. Like if you have a
that makes
soft
so much
midsole,
sense.
you're compressing that, and
Yep.
like after a month or two, if you were to, kind of X-ray the shoe, their toes are kind of up like this because they've put
They're
pressure.
jammed down, yeah, they're jammed down.
For as
No, that
much
makes
for
sense.
as much impact as your heel hits, you have the same amount of impact in the forefoot, right? So running more impact. So they put a lot of pressure. That's why most running shoes, people wear them out somewhere here too.
Yeah, as heel and the
Heel and forefoot,
the forefoot pads.
and they compress them down.
No, that makes sense. I remember learning that. What was this? Shoot, it was. I forgot where I learned this from, but was this for narrow shoes? I forgot what exactly. I think it was with like a narrow shoe. It'll like a narrow toe box can scrunch the shoes together, and then or scrunch your toes together, and then it's almost like instead of your whole foot hitting the ground, it's just like just this it hits the ground and just that hits the ground, and like wonder why I had pain on the first and fifth.
Yeah. So the last this way, sometimes it's here or sometimes it's here.
Okay.
Like I think most of these articles are online. So if you just type in William Rossi podiatry articles, and he had articles from the 1960s explaining all of this stuff.
Oh,
yeah.
The last of stuff? Oh.
Yeah, like in children's shoes. He had like this article on children's shoes.
Did you just have a flat last?
Yeah, flat last, because he was talking about all the different ways the shoes were. His article was called "How Modern Shoes Make Normal Gait Impossible," something like that.
Oh, it was back in the 60s?
Back in the 60s.
Yeah, what was that? I'll write that down.
William Rossi.
That's wild.
Don't quote me exactly on the name of the article, but it was something like that. Why shoes make normal gait impossible?
What's his last name?
Rossi, Rossi. And he was like one of the grandfathers of podiatry, William Rossi.
Make walking impossible.
Shoes make normal gait impossible. And he had diagrams on there, like when you elevate the heel, what it does to like your spinal posture.
Doesn't that anteriorly tip it?
Yeah, because you're here, but then up the chain you've got to compensate. If you're here flat, but now I move you like you have a slant board. So if I were to stand on your slant board and not fall, right? I've got to.
Yeah, you got to cheat. So it's got to go somewhere.
Yeah, I've got to like bend here versus.
Yeah. So essentially, your center of mass moves forward.
Center of mass moves forward.
So you have to lean back.
Yeah.
No, that makes sense.
And then you have all this shear across your spine. Then we don't want shear across.
I wonder why I have more back pain.
It's good for physical therapy visits, right?
Yeah,
I think so.
That's
Everyone's
stuff
got
that
back pain.
no one really talks about. Is like even a little bit of a heel lift. Like when I
Even a
would
little bit.
deadlift, if I wore like traditional like lifting shoes,
Yeah.
it's like the CrossFit shoes, Mark. They have like whether it's for like I don't know half a centimeter or even if it's 10 millimeters. When you deadlift, I mean, I would feel that. I'm like, why does my back feel tweaky? And I would go barefoot. I'm like, oh, this feels amazing.
So you
like,
felt better barefoot now.
yeah, totally barefoot.
I think I don't know, I'm not a power lifter, but I think for like competitive powerlifting, a little bit of heel gives you a little more leverage for competition.
No,
but that's
I know with
that's
like
for
Olympic lifting,
sport specific, but not for everyday functional wear.
Yeah,
you want to
And,
deadlift
like, it's probably
400
like,
pounds,
If you're
whatever.
a CrossFitter versus powerlifters, there's powerlifters. That's all they're doing. CrossFitters, we're doing a million other things.
Yeah. Then you want to be mixing it up.
I know with like Olympic weightlifting, they do it to. I think they do it to like like.
Yeah, it helps you get into your squat a little better.
Yeah, it's help with the squat, but yeah, that is the downside is if you're walking, doing it thousands of times, or running, like they might put your back in a not so good position, especially if you don't have a lot of control over it. No, I want to look that article up because that's from the 60s. That's it. It's like
I have
years
it on
ago.
my computer, I'm sure somewhere.
That's wild. What time is it? I don't know what time it is.
Yes, 3:35. So I got to get rocking here in a few.
Very good. Anything else you want to talk about?
No, I think that was good. Check out the Barefoot Science.
Yeah, I definitely want to check them out.
Check out Matt. He knows what he's doing. Yes, experiment. Everyone's an N of 1 human experiment, and you need someone to really spend a lot of time with you.